Question 1. A nurse is preparing to administer digoxin to a patient with heart failure. The apical pulse is 54 bpm. What should the nurse do next? A. Administer the medication as ordered. B. Hold the dose and notify the provider. C. Recheck the pulse in 10 minutes. D. Administer half the dose. Answer: B. Hold the dose and notify the provider. Rationale: digoxin should be held if the apical pulse is below 60 bpm. Administering could cause severe bradycardia or toxicity. Rechecking or altering the dose independently is unsafe nursing practice. Question 2. A nurse notices that two similar-looking vials, morphine and midazolam, are stored next to each other. What is the most appropriate nursing action? A. Use a red label on both vials. B. Report the storage issue to pharmacy immediately. C. Administer carefully without reporting. D. Move the vials to a new shelf independently. Answer: B. Report the storage issue to pharmacy immediately. Rationale: this represents a potential medication safety hazard due to look-alike or sound-alike drugs. Reporting ensures system-level correction to prevent errors. Question 3. A nurse receives a verbal order for a high-alert medication. What is the safest action? A. Write it down and administer immediately. B. Ask another nurse to witness the order. C. Read back the order to confirm accuracy. D. Wait until the provider signs it later. Answer: C. Read back the order to confirm accuracy. Rationale: verbal orders require read-back verification to prevent miscommunication and ensure accuracy before administration. Question 4. A patient on IV heparin develops bleeding gums. What should the nurse do first? A. Stop the infusion and notify the provider. B. Document and monitor. C. Administer protamine sulfate. D. Lower the infusion rate. Answer: A. Stop the infusion and notify the provider. Rationale: active bleeding indicates a possible overdose or complication. The infusion must be stopped immediately and the provider informed before any further steps. Question 5. A nurse finds that a patient refuses an antibiotic dose, stating it causes nausea. What is the best response? A. Insist the patient take it. B. Document refusal and notify provider. C. Crush and mix with food. D. Skip the dose without documenting. Answer: B. Document refusal and notify provider. Rationale: patient autonomy must be respected. The nurse must document refusal and inform the provider for alternative therapy or management. Question 6. A nurse is about to administer insulin glargine and insulin lispro. Which is the correct nursing action? A. Mix both insulins in one syringe. B. Administer glargine first, then lispro. C. Administer lispro and glargine separately. D. Hold the dose until breakfast is served. Answer: C. Administer lispro and glargine separately. Rationale: long-acting insulin glargine must never be mixed. Lispro rapid-acting can be given separately close to meals. Question 7. A nurse notes a medication dose exceeds the safe range. What is the first step? A. Administer as ordered. B. Clarify the order with the prescriber. C. Check with another nurse. D. Notify the pharmacist after giving. Answer: B. Clarify the order with the prescriber. Rationale: nurses are responsible for verifying medication safety before administration. A questionable order must be clarified. Question 8. A patient receiving gentamicin reports hearing loss. What should the nurse do? A. Continue infusion and recheck later. B. Hold the drug and notify the provider. C. Increase IV fluids. D. Record the finding only. Answer: B. Hold the drug and notify the provider. Rationale: ototoxicity is a serious adverse effect of aminoglycosides. Immediate action prevents permanent hearing loss. Question 9. Which statement by a new nurse requires correction regarding medication administration rights? A. I must verify the right patient. B. I can skip documentation if I'm too busy. C. I must check the right route. D. I must verify the right drug and dose. Answer: B. I can skip documentation if I'm too busy. Rationale: documentation is one of the essential rights of medication administration. Omitting it can lead to legal and safety issues. Question 10. A nurse is administering potassium chloride IV. What must be done first? A. Ensure the solution is diluted. B. Give undiluted via IV push. C. Add to a continuous IV drip bag. D. Administer AM. Answer: A. Ensure the solution is diluted. Rationale: potassium chloride must always be diluted and infused slowly to avoid cardiac arrest. Never administer IV push or IM. Question 11. A nurse prepares to administer warfarin. The INR is 4.2. What should the nurse do? A. Administer the dose as ordered. B. Hold the dose and notify the provider. C. Double-check with pharmacy. D. Give vitamin K immediately. Answer: B. Hold the dose and notify the provider. Rationale: INR above 3 indicates risk of bleeding. The provider must be informed before any action is taken. Question 12. A patient is prescribed morphine 4 mg IV every 2 hours, PRN for pain. The patient reports pain level 3 out of 10. What should the nurse do? A. Administer morphine. B. Offer non-pharmacologic comfort measures first. C. Document refusal. D. Notify the provider to discontinue PRN. Answer: B. Offer non-pharmacologic comfort measures first. Rationale: mild pain does not always require opioid intervention. Nurses should use lower-risk interventions first. Question 13. A nurse discovers a colleague signing off a medication not yet given. What is the appropriate action? A. Ignore and focus on own work. B. Report the incident to the charge nurse. C. Ask the colleague to correct it privately. D. Document for the colleague. Answer: B. Report the incident to the charge nurse. Rationale: this is a medication error and potential ethical violation. Reporting ensures accountability and patient safety. Question 14. A patient is prescribed IV vancomycin. The nurse notes redness and swelling at the IV site. What should be done first? A. Stop the infusion immediately. B. Slow the infusion rate. C. Apply warm compress. D. Continue and observe. Answer: A. Stop the infusion immediately. Rationale: signs of phlebitis or infiltration require stopping the infusion to prevent tissue damage. Question 15. Which action by a nurse prevents medication errors during shift change? A. Delegating medication review to UAP. B. Conducting a full handoff report with medication list. C. skipping report if time is limited. D. Trusting verbal updates only. Answer B. Conducting a full handoff report with medication list. Rationale. Handoff communication reduces medication discrepancies and ensures continuity of care. Question 16. A nurse must crush a medication for a patient with dysphagia. What should be checked first? A. If the medication is enteric-coated or extended release. B. If the patient has food allergies. C. If the provider approved crushing. D. If water is available. Answer A. If the medication is enteric-coated or extended release. Rationale. Crushing these forms alters drug absorption and effectiveness, potentially causing toxicity. Question 17. A nurse is giving medications through a feeding tube. What must be done first? A. Flush the tube with 30 milliliters of water. B. Mix all medications together. C. Crush and give all at once. D. Administer medication without flushing. Answer A. Flush the tube with 30 milliliters of water. Rationale. Flushing prevents drug interactions and tube blockage. Each medication must be given separately with flushing between. Question 18. A patient prescribed lithium complains of excessive thirst and tremors. What should the nurse do? A. Administer the next dose. B. Check lithium level and notify the provider. C. Offer more fluids. D. Document and monitor. Answer B. Check lithium level and notify the provider. Rationale. These are early signs of lithium toxicity. Immediate evaluation and lab confirmation are essential. Question 19. Which patient requires the most immediate nursing intervention? A. Patient with IN R2.0 on warfarin. B. Patient with digoxin level 3.0 nanograms per milliliter. C. Patient with BP 140/90 on lisinopril. D. Patient with mild nausea on metformin. Answer B. Patient with digoxin level 3.0 nanograms per milliliter. Rationale. This level is toxic. Immediate assessment and provider notification are required. Question 20. A nurse must administer an unfamiliar medication. What is the safest nursing action? A. Ask another nurse for instructions. B. Check a drug reference before administration. C. Administer and observe the effect. D. Delay until the next shift. Answer B. Check a drug reference before administration. Rationale. Nurses must understand the medication's purpose, side effects, and interactions before administration for safe practice. Question 21. A patient on a dopamine infusion for hypotension suddenly shows extravasation at the IV site with swelling and blanching. What is the nurse's priority action? A. Stop the infusion and administer phentolamine per protocol. B. Flush the IV line with saline to maintain patency. C. Elevate the limb and apply a warm compress. D. Notify the provider and document the finding. Answer A. Stop the infusion and administer phentolamine per protocol. Rationale. Dopamine extravasation causes tissue necrosis. The immediate priority is to stop the infusion and administer the antidote phentolamine to prevent ischemic damage. Notification follows after safety is ensured. Question 22. A patient with atrial fibrillation receiving IV heparin reports severe abdominal pain and low back pain. Vital signs. BP 88/56 millimeters of mercury, HR 122 BPM. What should the nurse do first? A. Stop the heparin infusion and notify the provider. B. Assess for bowel sounds. C. Increase IV fluids. D. Document and recheck vitals in 30 minutes. Answer. A. Stop the heparin infusion and notify the provider. Rationale. The patient shows signs of retroperitoneal bleeding, a life-threatening complication of anticoagulant therapy. The first priority is to stop the infusion and alert the provider immediately. Question 23. A nurse prepares to administer IV vancomycin when the pharmacy label reads, infuse over 30 minutes. What is the safest nursing intervention? A. Hold the medication and clarify with pharmacy. B. Administer over 30 minutes as written. C. Dilute with 250 milliliters saline and infuse rapidly. D. Give as IV push under supervision. Answer. A. Hold the medication and clarify with pharmacy. Rationale. Vancomycin must be infused slowly, at least 60 minutes, to prevent red man syndrome. A 30-minute order violates safe infusion protocols and requires clarification before proceeding. Question 24. A patient is prescribed digoxin and furosemide. The nurse notices new onset confusion, irregular pulse, and serum potassium of 2.9 milliequivalent per liter. What is the priority action? A. Hold both medications and notify the provider immediately. B. Administer digoxin as scheduled. C. Give potassium supplement after the dose. D. Document and continue to monitor. Answer. A. Hold both medications and notify the provider immediately. Rationale. Hypokalemia from furosemide increases digoxin toxicity risk. Confusion and irregular pulse suggest toxicity. Immediate provider notification prevents fatal arrhythmias. Question 25. The nurse receives a new order for IV magnesium sulfate for a patient with preeclampsia. Before administration, the nurse notes a respiratory rate of 8 breaths per minute and absent deep tendon reflexes. What is the safest nursing action? A. Hold the infusion and administer calcium gluconate. B. Reduce the magnesium infusion rate. C. Continue the infusion and increase oxygen. D. Notify the provider and wait for orders. Answer. A. Hold the infusion and administer calcium gluconate. Rationale. The patient shows signs of magnesium toxicity. The antidote, calcium gluconate, must be given immediately to prevent respiratory arrest. Question 26. A nurse finds that a patient's insulin lispro and regular insulin were switched during administration. The patient now reports dizziness and diaphoresis. What is the first action? A. Check the patient's blood glucose immediately. B. Administer 1 ampoule D50. C. Notify the provider. D. Document the medication error. Answer. A. Check the patient's blood glucose immediately. Rationale. The nurse must assess current blood glucose before any intervention. This confirms hypoglycemia and guides immediate action to prevent neurological injury. Question 27. The nurse is caring for a post-op patient on a PCA pump with morphine. The patient's RR is 8 breaths per minute and SpO2 is 85%. What should the nurse do first? A. Stop the PCA and administer naloxone per protocol. B. Reposition the patient and apply oxygen. C. Notify the provider immediately. D. Decrease the PCA basal rate. Answer. A. Stop the PCA and administer naloxone per protocol. Rationale. The patient has opioid-induced respiratory depression. Naloxone is the reversal agent and must be given before notifying the provider. Question 28. During a medication pass, a nurse is interrupted multiple times. After the last interruption, the nurse almost gives the wrong drug. What system-level intervention best prevents future errors? A. Implementing a no-interruption zone during med passes. B. Assigning another nurse to handle interruptions. C. Increasing nurse staffing for the shift. D. Double-checking orders only at shift start. Answer: A. Implementing a no-interruption zone during med passes. Rationale: reducing distractions during high-risk tasks like medication administration significantly decreases human error. Question 29. A nurse receives a patient from the emergency department with a fentanyl patch applied 2 hours ago. The provider orders IV morphine for pain. What should the nurse do? A. Clarify the order before administering morphine. B. Administer morphine as ordered. C. Remove the fentanyl patch first. D. Reduce the morphine dose by half. Answer: A. Clarify the order before administering morphine. Rationale: combining opioids increases risk of respiratory depression. Clarification avoids duplicate opioid therapy. Question 30. A patient on a high-dose corticosteroid regimen is to be discontinued abruptly. Which is the most appropriate nursing action? A. Contact the provider to taper the dose gradually. B. Continue the order as written. C. Increase fluid intake. D. Administer vitamin supplements. Answer: A. Contact the provider to taper the dose gradually. Rationale: abrupt withdrawal of corticosteroids may lead to adrenal crisis. Doses must always be tapered under supervision. Question 31. The nurse receives a critical lab report. Vancomycin trough level of 25 microgram per milliliter. What is the immediate action? A. Hold the next dose and notify the provider. B. Continue medication and monitor renal function. C. Flush the IV line. D. Lower the infusion rate. Answer: A. Hold the next dose and notify the provider. Rationale: a level above 20 microgram per ml indicates toxicity risk. The next dose must be withheld until reevaluation. Question 32. The nurse is administering IV phenytoin when the patient's heart rate drops to 40 bpm and BP to 70 over 40 millimeters of mercury. What is the nurse's immediate response? A. Stop the infusion and maintain airway patency. B. Slow the infusion rate. C. Administer atropine. D. Notify the provider and document. Answer: A. Stop the infusion and maintain airway patency. Rationale: IV phenytoin must be given slowly. Hypotension and bradycardia indicate rapid infusion toxicity. Stop the infusion first for patient safety. Question 33. A nurse is reviewing orders for a patient with cirrhosis who is prescribed acetaminophen. What is the safest nursing intervention? A. Verify the order with the provider before administration. B. Administer with food to prevent nausea. C. Give a half dose only. D. Administer and monitor for fever. Answer: A. Verify the order with the provider before administration. Rationale: liver dysfunction increases acetaminophen toxicity risk. Dosage must be clarified or substituted. Question 34. A patient with COPD is prescribed propranolol. What should the nurse do before administering? A. Clarify the order with the provider. B. Check oxygen saturation and give the dose. C. Administer with meals. D. Document as given. Answer. A. Clarify the order with the provider. Rationale. Non-selective beta blockers can worsen bronchoconstriction in COPD. The provider should confirm a safer alternative. Question 35. The nurse receives a stat verbal order for IV insulin 10 units regular. What should the nurse do first? A. Read back the order to confirm accuracy. B. Administer immediately. C. Ask pharmacy to verify. D. Document later after giving. Answer. A. Read back the order to confirm accuracy. Rationale. Verbal orders carry high error risk. Read back verification ensures patient safety before administration. Question 36. A nurse observes a colleague preparing to waste leftover narcotics without a witness. What is the appropriate nursing action? A. Intervene and offer to co-sign the waste. B. Ignore to maintain good teamwork. C. Document independently. D. Report immediately to management. Answer. A. Intervene and offer to co-sign the waste. Rationale. Controlled substances require dual verification. Immediate intervention promotes accountability and prevents diversion. Question 37. A nurse administers IV contrast dye to a patient with diabetes taking metformin. What follow-up is most critical? A. Monitor renal function and hold metformin 48 hours post-procedure. B. Encourage hydration and continue metformin. C. Check blood glucose every hour. D. Increase insulin dosage. Answer. A. Monitor renal function and hold metformin 48 hours post-procedure. Rationale. Metformin and contrast dye increase risk of lactic acidosis if renal function declines. Question 38. During medication administration, a patient questions a new pill's appearance. What should the nurse do? A. Verify the medication with the provider or pharmacy before giving. B. Reassure the patient that changes are common. C. Administer to maintain schedule. D. Document refusal. Answer. A. Verify the medication with the provider or pharmacy before giving. Rationale. Any discrepancy in medication appearance must be verified to prevent wrong drug administration. Question 39. A patient develops a rash and facial swelling after IV ceftriaxone administration. What is the nurse's priority intervention? A. Stop the infusion and maintain airway. B. Administer diphenhydramine IV. C. Notify the provider first. D. Apply a cold compress. Answer. A. Stop the infusion and maintain airway. Rationale. These are signs of anaphylaxis. Airway management is the top priority before additional interventions. Question 40. A nurse receives an order for 10 milligrams morphine IV every 2 hours PRN for an 86-year-old patient with renal impairment. What should the nurse do? A. Clarify the dose and frequency before administration. B. Administer as ordered. C. Reduce the dose to 5 milligrams independently. D. Give only for pain above 8 out of 10. Answer. A. Clarify the dose and frequency before administration. Rationale. Elderly and renally impaired patients have reduced excretion of opioids, increasing toxicity risk. Verification ensures safe dosing. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!